Good afternoon. My name is Nancy Pearlstein, and I'm an RN working with the Virginia Department of Health. Today, we're going to talk about operational and logistical aspects for COVID-19 therapeutics. Thanks for joining. The cost of availability of monoclonal antibody products has been brought to you by the federal government. Department of Health and Human Services has purchased the products that are available on the market today. These are Avail, Paxlovid, Molnupiravir, and Bebtalovamab. So when you obtain these medications, there should be no cost to your patients or to you for receiving these medications. There is one exception. IV remdesivir is available commercially from AmerisourceBergen and has not been purchased by Health and Human Services. Some practical aspects about monoclonal antibodies, or MABs, and the oral antivirals are that they have been allocated to the different administration sites by the state of Virginia's Virginia Department of Health. This change took place last September. Prior to the current status, these therapeutics were distributed from the federal government, and now each state is allocating to administration sites the therapeutics. Oral antiviral medications are going directly to outpatient pharmacies across the state, to community pharmacies, long-term care facility pharmacies, and hospital-based outpatient pharmacies. On this slide, we have a treatment locator tool, which you can find for all the states, but of course you'll want to zero in on Virginia to indicate which sites have received product. And we suggest you call ahead to make sure product is still available. I wanted to share with you expiration dates for Sutrovamat and Paxlovid. Although Sutrovamat is not currently being dispensed or allocated due to its lack of efficacy against the BA2 variant, it perhaps will be utilized in the future when it has efficacy against another variant. So we wanted to call your attention to the extended expiration dates and also to Paxlovid's extended expiration dates. Some implementations in practice. So prior to prescribing therapeutics, you want to confirm your patient is positive, with the exception of Evusheld for patients that are severely immunocompromised. This therapeutic is not for patients who are positive. You want to refer your patients to administration sites, and for practices that are directly administrating monoclonal antibodies, you want to ensure there's appropriate space and spacing to administer the therapeutics. You'll need a space for the observation period, the 1 hour after the medication is given. There is a required 1 hour observation period. And you'll also need appropriate staff to administer the medication and observe the patients. For those that are prescribing and do not distribute oral antivirals, there is a prescription required. The pharmacy needs to receive the prescription from the provider to administer oral antivirals. And for those dispensing directly from the provider office, that is when the provider has a physician selling controlled substances facility permit, and therefore can administer oral antivirals directly from the provider office. And one additional consideration is storage. Storage of the products must be taken into consideration. Additional implementations for practice for when you are a practice site dispensing is you will need to have the necessary permit that we already talked about. And if you are not already a provider site, the first step is to complete this enrollment survey. We at the Virginia Department of Health will help to facilitate your enrollment process to become a site, and this is the very first step. You will also have compliance and reporting requirements as an administration site. Molnupiravir and Paxlovid are ordered through VaxMax if you are not a federal retail pharmacy partner. And for those pharmacies participating in the Federal Retail Pharmacy Partner Program, please contact your FRPP for information on how to obtain therapeutics. The reporting requirements are daily for the mAbs and oral antivirals on the left side of this chart, Evusheld, Bebtalovamab, Paxlovid, and Molnupiravir. And we still request tracking weekly of any Regencov, Bam-Edi, and Sutrovamat that you have on hand. The teletracking website is listed here, as well as an email and phone number should you have any difficulty tracking. Also required is any adverse reactions. And through the FDA's MedWatch program, there is a link to report any adverse events. And should you have any trouble with the link, there's also a phone number. Billing for monoclonal antibodies is not permitted, as the monoclonal antibodies are free of charge from our federal government. However, there is billing for administration that may be charged to your patients. And here are some links to information on coverage for the administration of monoclonal antibodies and the Medicare reimbursement. Unfortunately, for the uninsured patient, the HRSA funding is no longer available, and they are not accepting claims for testing, treatment, or vaccines due to a lack of funds. To date, on April 14th, we have no update for additional funding from HRSA. Medicare payment for mAb infusions goes into a little greater detail on this side. There is a reimbursement from $350 to $550 for the monoclonal antibody infusion. And here is additional billing information with billing codes and payment allowances on the link at the bottom of this slide. Our next slide is an example of the link that you just saw, and this slide gives the Hitpix codes and reimbursement for Bebtalovamab from Eli Lilly, the pharmaceutical company. Well, the reimbursement is from the government, but it is a product from Eli Lilly. And the 350 versus 550 reimbursement is dependent on the location where the infusion is given. If it is given in an outpatient provider site, such as an emergency room, a clinic, the provider's office, the reimbursement is $350.50. However, if the Bebtalovamab is given in the patient's home or the skilled nursing facility where the patient permanently resides, or the assisted living facility where they permanently resides, then the reimbursement is higher at $550.50. And key to this home infusion is this is a permanent residence. They are not receiving respite in a facility or rehab in a facility, but it's the facility where the patient permanently resides. Some additional provider payment key facts. Of course, CMS can exercise discretion in their payment. And again, the payment is not for the medication, it is for the administration of product. And here are some additional resources for the uninsured and underinsured: Medicaid enrollment, the healthcare marketplace enrollment, covidtest.gov, and the HRSA.gov to find a health center. And additional questions that you may have for the uninsured can go to the HRSA link provided at the bottom of this slide. These COVID-19 therapeutic fact sheets that we have available to you on this slide are wonderful handouts that you may want to use for your patients for each of the therapeutics listed. And there's also a physician information form. And we have a COVID-19 treatment locator tool that will show you which sites in the state of Virginia have received monoclonal antibodies. And we just recommend you call first to make sure they have product on hand. And we want to just close with this slide, 2 email addresses to answer any questions you may have. These emails are for providers. They're not for the general public. So we would be happy to answer your questions and respond probably the same day or at least within 24 hours to all your questions on business days, Monday through Friday. And thank you so much for participating today. Have a great day, and thanks for all you do for the constituents in the state of Virginia. Bye-bye.